conference focuses on the topic of headache and migraine. It is correct to say that migraine, as a distinct form of headache, is not present in everyone. In other words, not all headaches are migraines. It is clear that headache is a frequent complaint with which patients address their doctors. According to statistics, 85% of patients who have consulted a doctor with various conditions have reported headache in the last year, and in the last 2 weeks, headache has been present in 38% of them. These figures indicate that headache is very widespread and requires considerable attention from both doctors and patients. Children and adults are affected by this health problem, and at the age of 7, at least 40% of children have had headache at least once, and by the age of 15, the percentage already increases to 70%. The most common causes of headaches without specific anatomical impairment are the same causes that affect the spine, eyes, teeth, temporomandibular joint, and other causes. Data shows that 10 to 12% of adults suffer from migraines, but only 25% of them seek medical help. This suggests that the actual number of people with migraines may be much higher, but people do not seek medical attention. In 70% of cases, migraines have a hereditary character, but the responsible gene for the onset of this health condition has not yet been identified. Migraine and psychogenic headache are much rarer than other types of headaches. By the way, high blood pressure causes headache much less often than we would like and then is considered. But regardless of that, blood pressure is measured for any headache, since everyone, especially now, in our times, almost every family has blood pressure monitors, and if suddenly the head hurts, then people obviously measure their blood pressure. Even a slight increase in blood pressure, taking a pill, seems to have made the pain disappear, but if these pains recur, then this is already a reason, above all, to consult a doctor. The most likely cause of headache and short-term headaches, I emphasize, short-term headaches are acute respiratory infections. In this regard, we remember in spring-autumn, flu, viral infections, the head hurts, all joints ache, the nose and eyes run, but sometimes the headache tires more than the same rhinitis, that is, nasal secretion. But long-lasting headache is typical of what is generally called nonspecific headache, and this pain is encountered in 20% or more of cases of chronic or psychogenic headache, with which people do not typically seek medical attention until a certain point when they go to a neurologist or psychotherapist or psychiatrist, and this diagnosis is given to them. Combined headaches can occur. This combined headache is caused simultaneously by multiple reasons. That is, this is depression, this is emotional tension, the cervical condition of the spine. These are primarily vascular diseases. As I already said, administration of medications and other preparations, including contraceptives. And also, migraines, psychogenic headaches, that is, there are many here, and with migraines and with psychogenic headaches, in general, these patients are under the supervision of a neurologist. First of all, it is necessary to understand that if you have frequent headaches, you need to pay attention to the so-called circadian rhythm of pain. That is, for people who frequently have headaches, it is desirable for them to make a schedule before consulting a doctor, that is, at what times, at what time of day this pain or that pain appears. So, if the pain appears in the morning, this makes it possible to exclude migraines, that is, the condition of the spine, depression, hypertension, sinusitis, volumetric formation inside the skull. That is, each of these diagnoses has its own peaks and its own characteristics during pain. In the case of the circadian rhythm of pain, psychogenic headaches can last for several days. There is the sinusitis syndrome. And the headache most often appears in the morning, exactly in the morning. And even the estimated time for sinusitis is from 9, with a gradual increase until 1 o'clock, that is, until noon, imagine, between 9 and 1 o'clock, with a constant increase and a peak of headache around this lunchtime. Then, for a few hours, the pain disappears almost completely, and people attribute it to different reasons but do not see a doctor. That is, sinusitis is quite difficult to diagnose and occurs, as you already understood, after infectious contagious nasal infections. Diagnosis is very difficult because in the case of sinusitis, there are often no secretions from the nose, there are no upper respiratory tract lesions, and obviously, instead of placing sinusitis, psychogenic headache is often placed, because patients start to torture the doctor in principle, and obviously, to make any diagnosis without adequately monitoring the patient, without asking about the disease they are facing, how they have suffered, how the pain has progressed, that psychogenic headache is diagnosed, and medications are sometimes prescribed that amplify the manifestations of these headaches. Nonspecific headaches are characterized by continuity and usually occur throughout the waking period, but they disappear during sleep. These pains are nonspecific to the patient and do not disturb their sleep. They fall asleep peacefully and do not wake up due to headaches. There are certain symptoms that allow the differentiation of pain and understanding of its cause. In children, the most frequent cause of headaches is acute viral respiratory infections. Otherwise, the causes of headaches are similar to those in adults. In children, headaches last longer, unlike in adults, and are often very long. Children get used to the pain if it is not too intense and sometimes do not even complain. Sinusitis is very rare in young children because the paranasal sinuses do not fully develop until the age of 5. Until puberty and before complete maturity, migraine is the most frequent cause of headaches in children. After puberty, headaches are more often psychogenic, meaning associated with hormonal changes. The prevalence of migraine increases with age. If at the age of 7 migraine appears in 1 child out of 100, in the group of over 15 years old, prevalence increases 5-fold. Girls, especially older ones, suffer from migraines more often than boys. Migraines have a genetic predisposition, as mentioned earlier. Migraine episodes are accompanied by a general feeling of discomfort, nausea, and vomiting. Vomiting is very rare in children, unlike in adults. In children, if migraine is diagnosed, the prognosis is usually favorable. Episodes gradually reduce. Classic migraine with so-called aura, which we will discuss later, is rare. In teenagers, basilar migraine is sometimes observed, and in young children, even hemiplegic, meaning the first episode of migraine can manifest as hemiplegia, where the limbs are practically paralyzed. If the headache becomes constant and worsens over time, a detailed examination is necessary because constant and worsening pain may indicate the presence of a volumetric mass in the cranial cavity, i.e., in the brain. Headaches caused by intracranial volumetric formations usually occur in the morning. This can be accompanied by nausea, vomiting, dizziness, ataxia, visual changes, and so on. It is also characterized by behavioral changes. In children, there is a decrease in academic performance. In such cases, urgent medical attention is required. In older individuals, the main cause of headaches are intracranial volumetric formations, tumors, subdural hematomas, giant cell arteritis, trochlear neuralgia, vertebrobasilar insufficiency, which can be accompanied by fainting and short-term memory loss. As age advances, the prevalence of cervical osteochondrosis and arthrosis increases, which can cause various pains. Migraine can be accompanied by transient visual disturbances and loss of sensation, sometimes reaching the level of anesthesia. For this reason, migraine is often confused with manifestations of cerebral vessel atherosclerosis. The diagnosis is difficult and cannot be established alone. It is especially difficult to diagnose when there are other concomitant conditions, requiring differentiation of the causes of constant or paroxysmal headaches. In the case of migraines, nausea is frequent, and in the case of transient ischemia, nausea is rarer. It is clear that all symptoms need to be closely monitored. If you do not trust your memory, write down the main symptoms during a headache episode. This way, you can understand the causes and not miss more complex diagnoses associated with headaches. Psychogenic headaches are usually bilateral. There are different types of headaches. If you have a unilateral headache, it is one type, and bilateral headaches more often accompany the psychogenic form of headaches. These pains occur daily and can last for several hours. Psychogenic headaches are usually observed in cases of emotional overload. Patients often do not notice or pay attention to these pains, as well as in cases of cervical osteochondrosis. The pain is annoying, but the cause is unknown, so self-medication begins, or we think of more serious problems. We understand that the diagnosis of any headache must be established by a doctor. The word migraine comes from the Greek hemicrania, meaning pain in one side of the head. This emphasizes that the pain does not spread to the other side and is always unilateral. The prevalence of migraines is approximately 10 to 12 people per 100 inhabitants. Most often, migraines affect women. The peak incidence in women is between 20 and 50 years old. There are several forms of migraines, each having its own specifics. The most common form is classic migraine, accompanied by headache, vomiting, and a premonitory aura, meaning symptoms that precede the appearance of acute pain on one side of the head. We have simple migraines, usually appearing without an aura, without warning symptoms. We have classic migraines, complicated migraines, and many other forms of migraines, accompanied either by hemiplegia, as in the case of hemiplegic migraines, or by basilar migraine, which affects the occipital area at the base of the skull. There is retinal migraine, where pain radiates into the nasal cavity. There is ophthalmoplegic migraine, also known as cluster headache, where the pain is felt in the orbits, hence the name ophthalmoplegic. There are headaches with symptoms equivalent to migraines, but without them being diagnosed as migraines. There is status migrainosus, when the pain persists for a long time and requires hospital treatment. There is also Horton's headache, which is slightly different and which I will discuss later. There is chronic paroxysmal hemicrania, atypical facial pains, and orgasmic headache, all of which have similar structures and mechanisms in affecting certain parts of the body. There is also cold-induced migraine, which can be triggered by any cold factor, including the consumption of cold drinks. All these types of migraines are caused by changes in vascular tone. Today, we know that there are triggers that cause migraines. Factors that can trigger migraines include stress, first and foremost. In second place is the menstrual cycle. During the premenstrual period, especially in younger women, such migraines can occur. Whether changes in alcohol, especially red wine, are also triggers. If you notice that after consuming red wine, one side of your face turns red and you experience pain, it is evident that you should exclude red wine from your diet and limit your alcohol consumption, especially red wine, as it can be a trigger for migraines. Also, certain foods have been proven to cause migraine attacks. Staying in a confined environment, our surroundings, strong odors, sleep disturbances, excessive fatigue, all of these can trigger a migraine attack, causing pain on one side of the head. Additionally, even skipping meals can trigger migraines in some people. It is clear that neck pain caused by osteochondrosis can also generate migraine symptoms. In the case of migraine attacks, migraine without aura appears in 75% of cases. A typical migraine attack occurs in 4 stages. The first stage, known in medicine as prodrome, appears in 77% of those who suffer from migraines and includes certain symptoms that occur 1 or 2 days before the onset of the migraine attack, i.e., before the aura and the actual headache. These symptoms can include yawning, irritability, and neck stiffness, all appearing 1 or 2 days before the attack, representing the aura that accompanies its development. There are various types of migraine headaches, such as chronic paroxysmal hemicrania, atypical facial pains, or orgasmic headaches, which affect specific areas of the head and are caused by changes in vascular tone. There is even cold-induced migraine, triggered by any cold factors, including cold drinks. Currently, we understand that there are triggering factors for migraines such as stress or menstrual cycles, especially in younger people, weather changes, and alcohol consumption, especially red wine. If consuming red wine causes one side of your face to become red in pain, it is evident that you should restrict alcohol consumption and avoid this type of wine as it can be a triggering factor for migraines, along with certain foods, the surrounding environment, strong smells, sleep disturbances, or fatigue. Skipping meals or neck pain associated with osteochondrosis can also trigger migraines. In practice, aura migraine appears in 75% of cases, and a typical migraine attack has 4 stages. The first stage, known as prodrome, appears in 77% of people who suffer from migraines and includes symptoms that occur 1 or 2 days before the attack, such as sneezing, irritability, or neck tension, which are called aura. The second stage is the aura, the third stage is the headache, and the fourth stage is the recovery. 25% of people diagnosed with migraines suffer from aura migraines, characterized by a gradual and reversible development of headaches. Usually, the neurological symptoms intensify during the first hour, primarily associated with visual sensations, changes in sensitivity or motor activity in the limbs, and many other symptoms that require treatment from a neurologist. The third stage of migraines is usually a unilateral and pulsating or pressured headache tendency to intensify during normal physical activities such as fast walks or climbing stairs. Nausea, vomiting, light and sound intolerance, and myoplegia can often occur in this stage. Without painkillers, Migraine headaches can persist for at least 4 hours, being exhausting and already known to people with this diagnosis, who take medication to reduce symptoms and prevent the extension of this condition. The fourth stage is the post-headache period, in which patients are usually weakened. Sudden movements of the head can cause temporary pain in the anterior location of the pain. However, the symptoms generally persist for a short period of time. The treatment for migraines is quite complex, and based on the experience of neurology specialists, the effect is temporary as finding the root cause is not that easy. Stress-related causes often occur in young people during menstrual cycles, and weather changes occur monthly, independent of us. Being in a confined room, even on a bus in heavy traffic, can trigger a migraine attack, up to a short circuit that can be very demanding. Thus, in the case of migraine headaches, changing vascular tone is a triggering factor. Triggering factors, especially foods, can be identified through careful examination. Migraine headaches can be related to no other somatic problems, occurring spontaneously or after a certain psychological tension. The nature of the pain, as we have seen before, is located in the frontal and temporal area, often radiating to the neck and orbit. The pain in migraines is characterized by strong intensity and a pulsating character, caused by changes in vascular tone and vessel spasms. These strong and pulsating pains are specific to migraines since there is a pulse wave in the arterial flow. Migraine attacks occur once or twice a month and can last from 4 to 72 hours, which means several days. On average, pre-migraine attacks lasts from 6 to 8 hours. These attacks occur spontaneously and usually in the morning. In general, migraine attacks resolve on their own, especially after sleep. If the attack has passed or medication has been taken, they have fallen asleep and do not feel anything. The primary factor triggering these attacks is emotional overload, as these pulsating pains make people lose their temper and increase emotional tension. Instead of calming down in some way, especially when everything appears for the first time, people go into a state of shock, and these unusual pains and evident nervousness aggravate the course of the attack for several days. In addition to emotional stress, the pain is amplified by physical exertion and physical activity, and nausea and sleep ease it. Practically, we have said that it can be alleviated during sleep. The specific accompanying symptoms of migraines, as I mentioned earlier, are not limited to nausea and vomiting, but also include irritability, visual sensations in the form of flashes of light, figures passing through the eyes, falling of the visual field in some areas, i.e., scleroma. Also, the main accompanying symptoms are paresthesias on one side of the body, as if ants start running under the skin. In children, the aura we discussed can be abdominal pain. We understand that, of course, 70% is a genetic predisposition. Cases of accompanying symptoms of migraine, bronchial asthma, neurodermatitis among close relatives are not rare. In practice, if this symptomatology appears, we understand that no one is immune to the appearance of these migraine pains. But once again, I emphasize that a large part of these pains is related to changes in vascular tone. We mentioned that the change in vascular tone is characteristic of Horton's headache. This pain, unlike the pain of migraines, is characterized by a strong, piercing or burning unilateral attack of pain, and attacks usually begin at the same time of day. They occur more frequently in series at night. If migraines have morning headaches, then Horton's headache appears at night and in series. Horton's headache occurs 6 times more often in men than in women. The accompanying pain in this case may include secretions, tearing, and leakage, which can lead to tears flowing, and the eye pain is usually accompanied by tearing. There is also redness of the cheeks, forehead, and eyes on the affected side, and sometimes the Horner symptom appears when the eyelids droop. We can thus observe very specific types of headaches in various diseases, even with different symptomatology. For us, a headache is simply a headache, and confusion arises because it is not clear why it hurts, and what the cause is. Cervical spine disease can also cause headaches. If there is an injury to the first to the third cervical vertebra, which is the upper section of the cervical spine, intervertebral joints, and intervertebral disc changes are usually sources of pain. The pain is usually unilateral and can radiate to the orbital area. In some cases, it can even be confused with migraines because the location of the pain is in the neck and can radiate to the temporal and orbital areas of the same side. Usually, the pain is average, of normal intensity, and can be alleviated by applying hot or cold to the neck. Attacks last from 1 to 6 hours and usually occur daily after awakening, end when blood flow is restored, or traumas to the cervical spine, such as those in car accidents, and even protrusions of the discs can be causes of headaches. Factors that usually predispose these pains include